Welcome. Thanks for joining. My name is Jo Glaviano. I'm with Aurora Health Alliance, and you are at the Aurora Health Alliance Firearm Injury Prevention webinar series, part 1. Thank you so much for joining us. I want to go over just a couple of quick little asks of you. We ask that you please stay muted unless you are speaking. Please, you're welcome to introduce yourself in the chat and also utilize the chat for questions and comments. And I will put this information in the chat once we've got more folks joining. So I wanted to start by just showing you and reading the firearm injury prevention statement that Aurora Health Alliance adopted in 2022. So I will read that for folks. And the firearm prevention statement is says that firearm injury is a serious and preventable public health crisis in our community. Aurora Health Alliance pledges to be informed, share resources, and promote existing firearm violence prevention efforts. So with that being said, we again are thankful for you being here and talking about this issue. We want to really keep this discussion with the lens of firearm injury through a public health, as a public health issue, and not around a debate on Second Amendment rights or criminal justice issues. We really are looking at this through the public health lens. So with that being said, our speakers today, as you'll see on the screen, Joseph Simonetti and Matthew Wetenkamp will be speaking first, followed by some time for questions and answers. And then we will have Johnnie Williams and Ginny McCarthy speaking, with again some time for questions and answers.
Welcome, everybody. I'm Joe Simonetti, as either Joe mentioned. Thank you so much for the invitation to be here today. I'm really excited to talk about this topic, one which I'm really passionate about. The next 10 minutes or so, I'm going to focus on the content of firearm suicide prevention, kind of the role of clinicians in firearm suicide prevention. Being very clear that I use that term clinician intentionally and to sort of represent a very broad population of people who work with people across different health and wellness settings. So I'm not speaking specifically about physicians or psychiatrists or even those who are narrowly working in the field of mental health. It's really anybody who's encountering other individuals on a day-to-day basis within the context of wellness and health prevention or health maintenance. So first of all, I think a question that often comes up is, why is it that I am so interested in talking about the intersection of firearms and suicide, and why do I think it's necessary for us to have an honest conversation about firearms when it comes to suicide prevention, particularly in the United States? And first of all, the reason is that when we say firearm violence or firearm injury or firearm deaths in the United States, I think we all have sort of different things that come to mind in terms of a scenario or a picture or a statistic. But it turns out that the story of gun violence in America is largely a story of firearm suicide. These are the 2020 data. I should probably update this with 2021. My slides are automatically going. And when we saw about nearly 50,000 deaths in 2020 from firearms injury, 60% of those deaths were suicide related. The majority of firearm deaths in the country are suicide specific. The other reason that we talk about the intersection of firearms and suicide when it comes to gun violence prevention is because when you talk about firearms and you talk about the role of firearms in suicide, it really highlights the reasons why suicides are preventable. So we know that many suicides, not all, but many, happen within the midst of an emotional crisis, a crisis that most, if not all of us, will suffer at some point in our lives. Matt Wetenkamp, who will speak next, often refers to as the worst day in anybody's life, which we're all prone to. couple of studies have shown, one in particular, when they spoke to young adults who had made very serious attempts on their life, but had survived. And they said, how long was it before when you made that decision to end your life and then you actually did the physical action? And about a quarter of them said they acted within 5 minutes. And most of them had acted within an hour. And so I think we sort of know this intuitively, but there's data behind it that many of these attempts happen in really, really short time periods. And so doing things with your firearms like secure storage or thinking about storing them outside of a house when somebody's going through a really difficult times at risk is something that builds in the time when somebody is in the midst of an emotional crisis and their ability to lethally act to end their life. The other reason that when we're talking about suicide, we're talking about firearms is not just that, about half of all suicide deaths in the country are related to firearm injury. It's higher among other populations. So when you look at older adults, or for instance, when you look at the veteran population, 70% of suicides are related to firearm injury. But unfortunately, firearms, there's another thing that's really unique about them, and it's that their lethality. So this is a little bit of a complicated graph, but this represents about 7 to 8 years of all suicide attempts in the United States of America, up to I think 2014 or so. And I'll sort of walk you through what the green and the gold bars basically show. The gold bars, so for instance, under drug ingestion here, is the proportion of all suicide attempts in the United States that are attributable to that method. So about 59% of suicide attempts in the country involve some type of drug ingestion. 21% involves some type of cutting. Only 4.8% involves some type of firearm injury. But I said earlier that half of suicide deaths in the country are attributed to firearm injury. So how is that the case if only 4.8%, this really vast minority of suicide attempts are related to firearm injury? And that's because of the differences in lethality. 89.6% of firearm-related suicide attempts result in death. That's 9 in 10 people who attempt to end their lives with a firearm will die. When you look at the vast majority of suicide attempts in the country, however, they're due to cutting and drug ingestion, and they're lethal less than 2% of the time. So the survivability is something that obviously makes a huge difference here. We don't want anybody to attempt to end their life. That is a tragic event, even when it is survivable, because it comes with a number of health and financial and psychological consequences. But we do know that at least when somebody attempts with cutting or drug ingestion or any one of these other methods, they are far more likely to survive than they would if they attempted with a firearm. And so I make the case today, and I will continue to make the case until somebody proves me wrong, that clinicians can and should help reduce firearm injuries and deaths. And I think many of us have a specific role to do that within suicide prevention. And we can do it using evidence-based methods, things that have been tested, that are acceptable to patients and providers. And I'll tell you a little bit more about what I mean by acceptable in just a minute. One of the reasons I think that clinicians have a really important role to play here is that because we're intersecting with folks, regardless of what our background is. We could be mental health clinicians, we could be working in an emergency department, we could be home-based primary care providers, geriatricians, we could be occupational therapists or nurses. We're engaging with individuals because of health issues. And a lot of what we do is health maintenance. A lot of what we do is address problems like dementia, suicide risk, drug and alcohol related disorders. We work with couples or individuals who are victims of intimate partner violence. Many people have children in the home. These are all scenarios in which there is not just firearm injury risk, but specifically firearm suicide risk. And so this is something that we are practically called to do on a daily basis. There's another reason that I think that clinicians have a really important role here. It's the largest workforce in the country. So more than 20 million Americans work somewhere within the healthcare and social assistance sector. And there are more than 1 million people working specifically within the mental health field. And I really do mean that it's particularly today, after a lot of the work that's been done nationally, it's not really just the mental health sector that is working in suicide prevention or firearm injury prevention. But really, when you think about the mental health sector, that intersection between suicide prevention, the care of mental health disorders like depression, firearm injury prevention and firearm suicide prevention, I think is specifically called for. And again, there's over 1 million people in the country working in that sector. And so I think that clinicians have a role in firearm suicide prevention and firearm injury prevention, not just because it's something that we can do and that I believe is acceptable to patients. There's just a lot of us out there who are interacting with folks within this context. Despite that, when you look at national surveys, this was just published, the national population of gun owners, fewer than 1 in 10 American gun owners has ever had a conversation about firearms with clinicians. And I bring this up just to point out that we have a long way to go, but there's some good news. I think one of the things that we've sort of struggled with over and over again is these conversations about discussing firearms in clinical settings. And it could be about suicide prevention. Maybe it's within the context of domestic violence. Maybe it's accident prevention when kids are in the house. I think a lot of people recoil and say, well, patients really, really don't want to talk about this. That's the craziest idea I've ever heard. And certainly we engage with patients all the time. I work clinically within the VA. We engage with patients all the time who aren't ready to have firearm-related discussions with us, which is perfectly fine. But when you look at national surveys of firearm owners, people who live in houses with firearm owners, veteran firearm owners, somewhere between 80 and 90% say that when somebody in the household is at risk of suicide, clinicians should routinely engage in conversations about firearms and firearms safety. And those percentages are similarly high when you change that context from suicide to mental health or behavioral problems, to when somebody's having trouble with drugs or alcohol, when somebody's a victim of domestic violence, when somebody has cognitive impairment or dementia. And this has been replicated in other studies as well. There's a really high degree of acceptability around at least the concept of clinicians engaging in firearm injury prevention, despite how maybe we internally react to the concept of it initially. So what is it that, as a clinician, as people who are engaging individuals in healthcare settings or in wellness settings, should be encouraging when we know somebody's at risk of suicide? This is the hard one. Some people do this, but I want to be clear, if we were to follow the evidence, and if you were to ask me today what I would do for my family member if they were in crisis, I would encourage them to remove their firearms from their household while they're going through that crisis. I want time and distance between my loved one and their firearm on the worst day of their life. And again, this isn't necessarily something that everybody's going to be willing to do, particularly if you're engaging them for the first time in a clinical setting, but this is the evidence-based recommendation. And that could be to take a firearm and store it with friends or family. There's some legal caveats to doing that, of course. You can store in storage facilities, and I and Matt and others have been working in Colorado to facilitate sort of storage options at firearm retail communities, which I think we'll get more to in this presentation. There's a number of different options out there. But again, this doesn't work for everybody, and that's fine, because when it doesn't work for everybody, there are a bunch of things that individuals can do to secure their firearms within the household. And I won't go through each of these. Suffice to say 2 points. There are a lot of different options for ways in which individuals can secure their firearms in the household to make sure that unauthorized users can't access them, whether that's somebody who's at risk of suicide, whether that's a 3-year-old, given that we know 3-year-olds have enough strength to pull the triggers of loaded firearms. The second point I'll make is that people have preferences, and there's no one-size-fits-all solution here. When working with gun owners, I'll say, hey, there's a bunch of different things you could do to secure your gun. What have you used in the past? What have people you've known in this situation done in the past? What devices work for you? And if really somebody doesn't have a preference or doesn't know anybody, I can talk about them. But using things like cable locks, using things like lock boxes, recommending gun safes and gun cabinets is a great evidence-based step for individuals who aren't ready to take their firearm out of their home, even temporarily. It's a great evidence-based step that you can take when folks have kids in the house. I feel really good about a parent who's willing to store their guns in a gun safe, as long as they're not willing to give the keys or a number combination to their kids. I feel like that's a really good intervention in that setting. We could talk for a long time about sort of the flip side of this equation, but I always want to acknowledge this side of the equation. When we have somebody who's at risk of suicide, we want them to get rid of potentially lethal items in their house or store them securely. And that could be some expired Tylenol in the cabinet that nobody uses. And in that situation, you know, it's pretty easy to say, go down to CVS and drop it in the disposal bin, right? Because it's expired and you don't need it anymore. Maybe that's not so easy because somebody has to drive. Maybe somebody with limited financial means even getting rid of some expired Tylenol is a cost that they have to grapple with. This is a real thing, unfortunately. But that value is probably in most cases minimal. We're talking about firearms, it's something different than that. Some people will see this slide and know immediately what I'm talking about. Others won't. But particularly in the United States, many people, not all, but many people attach significant value to gun ownership and use. And whether that's hunting with family, sport shooting, using them as collectors or sentimental values, as expressions of identity or liberty, or literally as financial investments. We are asking people to make really hard decisions with their firearms. And so I sort of end by saying, I think as clinicians and people working with people at the intersection of health and wellness, it is part of sort of evidence-based care. And I think part of our professional responsibility to have hard conversations with folks about things they can do to reduce their risk. At the same time, I think it's important for those of us who are not in the gun community ourselves to recognize why some of these behaviors are going to be really challenging for folks. And so when maybe folks follow our recommendations, that's great. When maybe folks don't follow our recommendations, we recognize that we've done our professional responsibility and we'll continue to work with folks. But couching our bias and our judgment at the door when we don't necessarily align in terms of our recommendations, I think is a really important thing. With that, I'm going to finish up and I think we'll save questions for a little bit later, but thank you again for the opportunity to be here today.
Again, my name is Matt Wetenkamp. I'm with the Firearm Injury Prevention Initiative at CU Anschutz, along with Joe. Let's see here. There we go. Quick roadmap. I'll introduce you to FIPI, talk about firearm injury in Colorado, what we've learned about lethal means safety in suicide prevention, how that can apply to firearm injury prevention of any kind, and then a little bit about some of the community conversations that I'm having, and hopefully robust discussion and Q&A afterwards. There will be some overlap between Joe and I's slides. I'll skip through that fairly quickly. These slides will be available to you afterwards, so please feel free to take a peek at those if there's anything that you missed. Quick introduction to FIPI. Really ramping up here in the last year or so, bringing new staff on board and new funding available to bring this messaging out to communities across Colorado. Looking to use really prevent firearm-related injuries and deaths in our homes and communities. Create that future with zero firearm-related injuries or deaths. Values really was mentioned before, but the common goal of health and security, respect for those diverse views on this topic of guns, and direct engagement with the impacted communities. 3 core areas we look at to do this: research, education, and my area of collaboration. Firearm injury in Colorado. Joe mentioned some of the national numbers. It's actually even more stark when you're looking at just Colorado numbers. So it's about 60% of firearm deaths across the country are suicides. In Colorado, it's closer to 3/4 of firearm deaths are suicides. Over 1,000 firearm deaths in 2021. That was an increase from the year before. And so really when we're talking firearm death in Colorado, again, 3/4 of those are suicides. The 22nd highest rate of firearm deaths in the US as far as states go, and 7th highest when you're looking just at suicides. And again, more than half of those suicide deaths in Colorado are via firearm. And so the way I look at this when we're talking about it, we're talking about secure storage, saving lives. What we're really talking about, we're looking at is 2 different types of access, or 2 different types of concerns with firearm access. The first is unauthorized access. So someone who is not authorized to access that firearm, not an authorized user, not the owner. Preventing unauthorized access, you're talking maybe youths that are in the home, other people who are within the home, being able to prevent accidental death or injury by youth suicides, and gun theft in particular. I found a statistic where in Larimer County, over a 4-year span, there were over 800 guns reported stolen in Larimer County. So you're talking over 200 guns a year stolen, and that's just the reported thefts. That's just in one Colorado county. And then the second area of focus when it comes to secure storage is that unsecured access. And the concern here is firearm being immediately accessible to the gun owner or authorized user in a moment of crisis. So again, on the worst day of your life, having the most lethal tool available, risk of it being used in a suicide or a homicide attempt, or having it immediately available during a domestic dispute or domestic violence incident. And we know that paying attention to these things works. We've seen it all across the world. A few examples here. When you have a society that where one particular means of attempting suicide is used more than anything else, paying attention to that, paying attention to the accessibility of those means always reduces the suicide rate. We see it in Sri Lanka and other countries in Asia, where highly toxic concentrated forms of pesticide were the #1 method of attempting suicide. Those most highly toxic types were banned or not available in their concentrated form, and you see the suicide rates drop by 50%. In Britain, the #1 method of suicide was domestic gas within the home. Gas was changed to be non-toxic. Suicide rates dropped by 33%. And we know it works with guns too. We see it in the Israeli military. Vast majority of suicides were via firearm, via soldiers in the Israeli military. It tended to happen at home on the weekends because they were required to bring their weapons home with them on the weekends. They changed that policy, required soldiers to leave them at home, check their weapons in on base before they went home for the weekend, and you see suicide rates drop by 40%. In that model, Joe mentioned many of these statistics, so I won't beat a dead horse here, but there are two real areas of concern and message in the messaging that we take out into the community and talk to gun owners and anybody else about. And those two focus areas for me are the impulsiveness and the timing of the suicide attempt, and the access and the lethality piece of firearms. Again, Joe mentioned this timing. We do know vast majority of the time, the decision to go through with the attempt happens within minutes. It's not days, it's not weeks, it's not months, it's minutes. Break that down just a little bit further there. You can see some of the statistics there. Almost a quarter, less than 5 minutes. Almost a quarter, that 5 to 20 minute range. When you add up those first 3 bars, you're looking at around 70%. Again, the question that was asked was, once you decided to attempt suicide, how much time passed before you actually took action? And you're looking at 70% of survivors said it was less than an hour. Very impulsive time, very impulsive moment. And again, the impulsiveness comes with the fact that we also know that the majority of suicide attempts happen within 24 hours of a personal crisis of some kind, whether that is job loss or divorce. Something is going on in that person's life, a major crisis, and they make a very impulsive decision during that window of crisis. And then the second piece of it is the access and the lethality piece, right? We know that availability of the most lethal means, and in this case, we're talking firearms, is strongly correlated with suicide attempt outcome and whether it's fatal or not. This is something that I talk about a lot when I go out and I'm talking with firearm owners about this. You see studies that say, firearm ownership indicates an increased risk of death by suicide. And that can be taken the wrong way. I've had responses to that, questions like, oh, so, gun owners are more likely to be suicidal or have, mental health issues. No, anybody is capable of having the worst day of their life. Anybody is capable of finding themselves in crisis. The difference is that gun owners, when we have the worst day of our lives, we have that 90% lethal tool. Joe had that slide that showed the lethality of the various means. If you lump together all non-firearm attempts, they're fatal around 10 to 15% of the time if you lumped in all those other means. Firearms fatal 85 to 90% of the time. All other attempts combined 10 to 15%. And so in that worst moment, on that worst day of your life, having access to that 90% lethal tool. Again, that lethality piece. 85 to 90% of attempts with a firearm are fatal. And just a moment to talk specifically about youth suicides. A recent study, I know Ginny is going to be talking about this, so I won't go into it too heavily. But again, we know teens have access to guns, even if their parents think they don't, even if their parents think that, I've taught my child how to use firearms appropriately, they respect them. We know they have access to them. And we know that we've got around 100 youth in Colorado dying by suicide every year. Around 40% of those are with a firearm, and around 80% of the time, it's a firearm that belongs to a family member. And so this is, a lot of my work is around taking this message out to the community, gun owners in particular. We go to gun shows and other opportunities to speak directly with gun owners on this. But it's worth thinking about, what drives ownership and storage behaviors for gun owners. There's so many different things that go into it. So there's not ever going to be a one-size-fits-all solution to firearm storage in that moment of crisis. We talk about geography. Rural areas, much higher rates of gun ownership than urban areas oftentimes. What's the purpose of utility? Why do they own that firearm? Are there children in the home? Is the firearm, they own it for work, or is it for personal protection? What are the number, type of firearms that they own? How often do they use it? Is it a gun that they just use 1 month out of the year during hunting season? Or again, is it something that they're using for work on a daily basis? And perhaps most importantly, one of the things that we spend a lot of time talking about is the belief in that firearm suicide relationship. We spend a lot of time discussing that with folks and the access and lethality piece. One thing that always comes to mind here on this point is we often talk about, or you might hear about the safest way to store a firearm is with the firearm and the ammunition both locked up and stored separately. I don't tend to promote that. We don't tend to talk about that a lot because we know it's a non-starter for a lot of gun owners. One of the number one reasons for owning a gun is for protection of myself and others. And if your gun and your ammunition are stored separately, that is not something that can be accessible in a moment of crisis if you need to defend yourself, your home, or your family. And so finding ways that fit an individual's needs for that firearm. And really, and a focus on respectful, informed conversations, understanding those motivations, their reason for owning guns. What does gun safety mean to them, and how can we talk about the different ways of being safe? Maintaining control of that firearm. We talk about in-home and out-of-home storage options. How can we keep everybody safe within the home while also maintaining control over those firearms? And I think the honest approach is always best. There's going to be different approaches for different messengers, but sticking to those focus areas of the impulse and timing, the access and lethality, having an understanding of that, and how can we work within those areas to find secure storage options. We also talk about language. Language really matters. The messenger matters in this, and the language matters in this. A few examples of ways that we change the language in how we talk about this. Rather than gun violence, firearm injury and death. Instead of using terms like restriction or confiscation, focus on the temporary and voluntary nature of out-of-home storage. A few more there. Again, we'll have these slides available. And a few examples of how to have that conversation. I think that's a big thing for a lot of people, whether it's someone who works in healthcare or just a friend or family member. How do I ask? How do you have this conversation with someone? And just a few examples of that. Things like, what do you think about storing your guns out of the home, off-site, just until the situation improves? Or have you thought about how to keep your kids from accessing your guns when you're not with them? I'm not against guns. I just want your family to be safe during this difficult time. And avoiding terms like, must give up, need to dispose of, have to relinquish. I mentioned earlier a lot of the outreach that we do. I've been to 3 gun shows in Colorado so far this year. We've got 3 more gun shows coming up before the end of the year. We'll be in Montrose next weekend for the gun show there. We've got one in Aurora in October and Pueblo in November. And what we do here is we've got a short questionnaire that we ask folks to fill out. They stop at the table. Just takes a few minutes to fill out. The first 5 questions are more of a quiz than a survey. They have right and wrong answers. Questions about what's the #1 cause of fatal firearm injury in Colorado? Obviously, we know here it's suicide. The majority of people don't know that. What we've seen over the first 3 shows is that well over half of respondents answer something other than suicide. And so it could be something as simple as that, planting that seed in people's minds and give them something to think about. And then anybody who fills out that survey, it's completely anonymous. We don't collect any info unless they are interested in a follow-up. So totally anonymous, takes a few minutes, and then they can take a free lockbox. We have a couple of different models that we bring. Sometimes we do raffles for nicer, higher quality lockboxes. But it's been a fantastic experience so far. I've collected over close to 500 surveys through those first 3 and hoping to do the same over the last 3. And again, Joe mentioned no one size fits all. There's a ton of in-home solutions. Depends on, again, all of those things. What do they use? What do they own? What do they use it for? How accessible do they want it to be? So really helping people understand the factors that go into the decision of what to use in your home. And then out of home, family members in Colorado, it is legal to transfer your firearms to a family member without having to go through a background check. And it's a pretty broad definition of family. That's with the caveat, of course, that family member is not for any reason ineligible for firearm ownership. As long as they are able to own firearms, you can transfer them to them. And then that link there, that QR code, will take you to the Colorado Firearm Safety Coalition's safe storage map. And so that's a map of police departments, gun shops, shooting ranges, storage facilities, pawn shops all over the state of Colorado who have said that they would be willing to offer to store firearms at their facility for a family that needed to get them out of the home temporarily. And that is all I've got. I'll leave this up here for a moment. That is our website, and there's my email address. The QR code will take you to a sign up for our newsletter. But I'd be more than happy to answer any questions. Anybody ever has any follow-ups, something comes to you days or weeks down the line, please reach out to me. Always happy to have conversations, any way to bring this discussion to the community.
Thank you so much, Matt and Joe. Both will take some questions now, and we'll get to as many questions as we can for a few minutes, and then but please feel free to put them in the chat as you think of them, and if we don't get to them all today, we'll capture them and get them answered for you. So there is one question in the chat. Are there any professional development or learning opportunities for healthcare providers? I have heard from a couple of their concerns in alienating patient relationships by simply asking the gun ownership question when there isn't a crisis happening, but as a means of safety or prevention. Great question.
Yeah, that's a great question. There are sort of a number of courses out there now, most of which are free. The VA makes some available to community practitioners, even those who are not VA employees. The American Medical Association has a fantastic online free course, and if you Google it, you'll be able to find it. There is also a training called CALM, C-A-L-M, that is available for free. I would point individuals to the Bullet Points Project out of the University of California, which is a very fantastic website, which provides great tips and guidance and scripts and clinical scenarios on firearm counseling across a couple of different clinical scenarios like suicide or kids in the house. I think their materials, while it's not technically a training course, I think their materials are really fantastic and are the best. And, you know, the Firearm Injury Prevention Initiative at the Anschutz School of Medicine, we also provide trainings as well. And so if there were a group of clinicians or community members who wanted to know more about this, I'm sure that we could facilitate something. I know the second question was, I heard a couple of concerns in alienating patient relationships by simply asking when there isn't a crisis happening, but as a means of safety prevention. You know, I can't tell you that these things don't happen. Sometimes simply asking a question is enough to upset folks. I've had many conversations about firearms with my patients. This has never happened to me. I think in the vast majority of instances, in almost all instances, if you have a respectful patient-centered dialogue and stance towards somebody, and you're asking a question within the context of their health and well-being, it is received well. I'm not telling you that they're going to say, yep, doc, I want to sell my guns today. I'm not telling you that they're even going to be willing to engage in a conversation about firearms or tell you how many guns they have. That might not be the case. There are a number of things that our patients are not going to divulge to us, or just not ready to have conversations about across the spectrum of health behaviors and decisions. That's totally fine. But I think the instances where people are like truly dismayed or upset simply by asking the question, those are rare in my opinion.
The other thing I would just add to that is, you know, we talked about the message really matters. You know, how you frame your messaging and how you ask the question really matters. And you know, being able to train yourself or prepare yourself in some way. Some of the training courses Joe mentioned. Also, one of the founding members of that Colorado Firearm Safety Coalition I mentioned, Dr. Michael Victoroff, is a family medicine doctor for CU. He's also a lifelong firearm owner and marksmanship instructor. He's got some great trainings that he provides for medical professionals on this very topic: how to have informed conversations. You know, different setting than a medical setting, but for me personally, you know, say going to these gun shows, I was very hesitant at first. There might be some very difficult conversations coming from CU and coming out and wanting to talk to folks about, you know, how you store your guns and what the concerns are. You know, over the course of close to 500 conversations at those gun shows, I probably count on one hand the number of conversations that were difficult and combative with pushback. I think having the right framing, that impulse and timing, access and lethality piece, sticking with that and using that framing of the topic, it does resonate with people, and they understand.
I had a question. Thank you, Matt. Thank you, Joe. It's just a data question a little bit. In both of your slides and talking about suicide attempts, I just wanted to get a little bit more specific. I know you aren't the ones who collected it, but do you know what the definition of the suicide attempt was? Like, was it an intentional attempt to end life, or was it a negligent, like they should have known, especially with like pills or another action? Was it an intentional action or more like negligent? Like, would a rational person know that could end up ending a life, if that's making any sense?
Yeah, no, that's a great question. So something I didn't clarify, but I'll do now. I said they were all suicide attempts in the country. It actually was not. It was all suicide attempts in the country that came to medical attention. That's an important distinction, because a lot of people have self-harm, whether it's with an intent to die or not, at home, and never end up getting medical care because of it. So these are folks who had to get medical attention, and a clinician during that encounter added a code that said suicide attempt, and a couple of different codes related to that, but the clinician identified it as a suicide attempt. Obviously, there can be some ambiguity around that, but those are basically the nuts and bolts criteria.
Thank you. I'm trying to drill down a little more always when there's data in front, like who did the data, why, was there bias, all of that. So stay with me, Aurora Health Alliance folks, while I continue to always ask about that in future meetings. Thanks.
Great, thanks, Mandy. Why don't we take one more question? I wanted to also open it for folks that maybe don't have access to the chat. If anyone's on the phone and just wants to come off mute and ask a question, otherwise we'll move on to our next speakers. Okay.
I have a question again. I'm full of them always. Is there an opportunity for folks who are like that have work at a gun range or at a pawn shop or things like that through your programs to provide training or about how to have these safe storage solutions? Or maybe I'm stepping on Ginny and Johnny's toes there. Maybe it's a good segue, but I think it would be awesome to have trainings like on how to do those conversations with those key stakeholders in the community.
Yeah, and I think some of it happens just, through the course of our outreach, getting connected with folks. The one thing I will point to, or one project is, it's called the Gun Shop Project. It's not out of CU, it's out of the Colorado Department of Public Health and Environment in their Office of Suicide Prevention. I worked on that for a few years, and that involves representatives from around the state going out to the gun shops, pawn shops, shooting ranges, etc., in their community and having these conversations, bringing out materials, tips and tricks on how to have the conversation, warning signs to look for, and spreading awareness on this topic. So it is happening through the Gun Shop Project, through CDPHE, and I think it's something that's kind of slowly growing with us through FIPPE, through some of this gun show outreach, and other conversations in the community. We see more and more, and you'll see it on that safe storage map. You'll see the number of locations around the state of gun shops and shooting ranges who have said, yes, we see it. We know this is a problem, and we see the role that we can play in suicide prevention, and have volunteered their storage facilities for folks. So absolutely, there's opportunity there.
Thank you.
Thank you both so much. I'm going to move us along to our next speakers, Johnnie Williams with DenverYouth Program and Ginny McCarthy. But thank you both so much for being here.
Hello, everyone. Glad to have everyone here today. Definitely want to thank Matthew and Joseph for all of the wonderful information there. And we're going to be chiming in and probably referring back to all of the statistics that you've seen and the work that's being done and the procedures that are around gun safety, and the way that we work with it as well, specifically with the youth, talking about how we engage with the youth and some of the conversations. And as Matthew mentioned, our conversations are very organic, and there is not a lot of pushback with the conversations that we're having with the youth. But we're going to flip the script a little bit. We're going to talk about what do we do and how are we communicating and conversating with them prior to the decision to actually look for and have access to a weapon, the behavior parts that happen before that. We definitely acknowledge that with the guns not being as accessible, or there being locks on the guns, or not being present at all, definitely will affect the level of violence that are happening due to guns. We acknowledge that wholeheartedly, but we also believe that some work has to be done on the forefront of that. Some work has to be done prior to that point. And I'd just like to share one of the situations that I was intimately involved in when the police officer got shot in City Park. And I was there, and bullets were flying past my head, and everyone was focusing on the travesty in the moment of how these young people were shooting at each other, and they were running, and lives were in stake. And my mind automatically went to what happened in the home the morning that child put that gun in his waistband and decided it was a good idea to bring it to a park full of people on a day where it was supposed to be celebration and jazz. Something was going on prior to that. And we help identify in our groups and in our resources, what are those behaviors and what are those thoughts and what are those situations that these young people are going through prior to thinking about harming themselves or harming others, and how we can get in front of that. Because something that we've also learned through the work that we do is, if a decision has been made and they stand firmly and strongly enough on that decision, they will find a way. Right. So we definitely want to make sure we address that. And as we're moving forward, and I'm going to let Ginny jump in and talk about how we are connecting with the work at CU. And then we'll come back and talk about some of the resources that we do provide for our youth and families in our community around the behavior part of accessing and using guns to harm self or others.
Great, thanks, Johnny. So I'll share a little bit. These are our affiliations, so some of them anyway. Wanted to connect the work that GRASP and Denver Youth Program is doing with some of the work that we're doing through CU and how I got involved in the work. And then we'll go into a little bit more of the granular breakdown of the programs and how they function and who they serve and who's incorporated and to what end. So my name is Ginny. I have a few different affiliations listed there. I came to this work, I'm a doctoral student currently, but I came to this work looking specifically at community violence and specifically firearm injury prevention at the community level. So like Johnny said, looking at what the data are and how the burden of injury and death is distributed in the community, mostly interpersonal violence would be probably the area that I've been focusing on the most. Although Matt, I should have brought the article up a little bit more about youth access. We had an article come out recently through the Firearm Injury Prevention Initiative and the Injury and Violence Prevention Center on youth access. And so we did see that youth report access, but we don't know exactly where. And the next, through Healthy Kids Colorado survey, which is a statewide survey that's conducted every 2 years. And so that side of the work is going to continue with the fall survey in 2023. And there is a question on there that's going to ask a little bit more specifically about where youth access guns. And it was all kind of very surprising that was able to be put through, because like we have been talking about in this webinar that Matt and Joe covered so beautifully, there is sometimes hesitation, whether it's around why are you asking, who are you to ask, what do you want me to do because you're asking me these questions. So understanding that parents were protective, schools were hesitant, school boards were hesitant to ask some of these questions about access. And then youth can sometimes be hesitant to answer because they don't know who's going to do what with that information. And so we actually feel very fortunate to be learning some of that, because it does go back to Johnny's question of when we're talking about youth carrying guns, we want to know why are youth accessing guns in the home or outside the home or near the home. How quickly can you gain access to a gun? How easy is it to access a gun? Where are you accessing the gun? And then that's part of the question. We go quickly to the gun, but then if we don't address the question of why youth are accessing guns and address that the cause or address that primary source, then we're never going to get away from youth carrying guns or accessing guns. It's going to be tremendously difficult. So do you want to say more about who you are and how you came to the work, or do you want me to go to programs?
Well, I'll say a little bit more about, I have lived experience with the community around coming from Chicago and seeing some of the trends that happened out there, moving to Denver and seeing some of those trends be 7 to 10 years behind what I grew up with in Chicago, and trying to get in front of some of the trends that we saw coming our way. And that went from having youth who have altercations or into situations that they are involved with violence, moving from just hand-to-hand combat to knives being involved to guns being involved, and then watching the trend of use, carrying, and access, and how that trend changed. It started out with having access to weapons that they may not have actually access to, actually carrying those weapons, to then the level of how willing they were to use the weapon. And right now we're, as Matt has stated, we're in a pandemic of the fact that now the line is so closely met. If I have access and I gain access, I'm going to use it, versus I may know where a gun is and I'm never planning on touching it. Or I do carry a gun, but I'm never planning on using it. And now the trend is, if I have a gun, there's going to be a high chance that I'm going to use that weapon, which is why, again, we're focusing a lot on preventing them from wanting to ever access it in the first place, so that they will reduce their opportunity or the chance to want to use it. So some of the ways we engage with our community in regards to resources that they have around not only the safe storage, safe purchasing of the families that are using these weapons for protection of their families, as we heard earlier in the presentations, but also the propensity for our young people to access the weapons the way that they normally do, through theft, through accessing them with friends that are having them in their homes. And then something that we learned is sometimes the theft of these weapons happen amongst the youth that are in a ring. So I may not use a weapon that I steal from my own parent, but I might help my friend steal it from my parent. And then these weapons are then being transferred around within the youth that are in those rings. Automobiles, we talk a lot about teaching people how to safely secure their weapons in their automobiles, because a lot of weapons that are being stolen out of the automobiles. And there was a question earlier about pawn shops. Again, there's been a lot of work around the pawn shops, and not only their procedures around selling these weapons to whomever, because a lot of times youth will have someone purchase a weapon for them, then report that weapon stolen, so that they can have access to it. But pawn shops being more diligent around the waiting time, the background check that they do, and then how they're storing their weapons overnight so that they're not easily stolen from their shops themselves. And then one of the things that we had success in working with, and Walmart was one of the first people that we had dealt with that, is a place that sells weapons not readily selling ammunition along with those weapons, and having to go to two different places to access weapons versus the ammunition has also been able to add to the timing that Matthew and Joseph was talking about. If it takes me that much longer to put this piece together, then I'm less likely to be able to access it in a moment of crisis. So one of the things we do is that one-on-one mentoring, to be able to provide these youth with someone that they can talk to when they are in stressful moments or traumatic situations, and they can have that one-on-one mentoring that guides them to a place to where they're not as willing to cause harm to anyone by any means. Then we have the Greater Outdoor Colorado, our GOCO program, and that helps people, these young people, to learn more about the outdoor spaces. And so if they're talking about using weapons for hunting, then what does that mean? What are the hunting laws? Getting to be up close and personal with nature, to where it's not just a thing that they're doing for fun, but to actually do it in an intentional way, to where they are learning about what game is to be hunted and what game is not to be hunted, what animals are protected, and then to get up close and personal with these animals, so that it's not just for a fun thing. That sometimes when youth have been harmed as young people, hurt people. So just wanting to shoot and kill something is something that we've dealt with. And since they've not risen to a level of causing harm to human beings, they cause harm to animals. And that's been something we have to watch out for as far as behavior as well. So our Greater Outdoor Colorado program, it teaches them out and teaches them. And they get to interact with animals and animal skins and the nature and where these animals habitat. So that gives them a different approach around it. And then we move into the GRASS program, where weekly we talk about the situations that a young person might be dealing with that'll put them in the mindset of self-harm or harm to others. And that's around drug and alcohol use, gang issues, violence in the community, interpersonal violence, as Ginny mentioned earlier, the lack of resources in a time to where they feel like they don't have anything, grief, loss are some of the things that put them in that place. And in this group, this support group weekly, we talk about what are your barriers, what are your burdens, what are your baggage that you carry, and then what are the resources you need to get you past that. So we don't actually just focus on the weapon itself or the choice of weapon, but what is the mentality that may lead you to that? And how do you reach out to someone to help you move away from that mentality in those times of crisis? And all of my staff members have numbers and phone numbers and sometimes pagers, so our young people can reach out to them at any moment that they need to have that other voice in their head to steer them in another way. And I'll let Ginny talk about the AIM program.
All right, I'm gonna talk about GRASP Enterprises too, is that okay?
That's it.
I'm gonna go from GRASP to GRASP Enterprises and then I'll go over to AIM. But one of the things that no, you're right. I'm gonna talk about AIM, but I'm gonna change slides and then I'm gonna talk about GRASP Enterprises as part of that. So the AIM program, the At-Risk Intervention and Mentoring Program, was started in 2010 at DenverYouth. And this came really, and I feel bad speaking about this because Johnnie was the reason this all started. So you should interrupt me at any time. But this is really that bedside hospital response, emergency trauma pager goes off, or having access to the patient boards and being able to see who's being injured where and how urgent it is that someone respond, and seeing their overview of care. So the AIM program, beginning at DenverYouth in 2010, recognized that need for someone to be there, to be a liaison. So initial support, liaison between the patient and the healthcare team, understanding what can then through HIPAA and patient release be able to be conveyed back to the family. If there is fear of retaliation due to the nature of injury, being able to be in the waiting room, receive people as they arrive, understand who can know what and when and how, and make sure that the risk assessment is being conducted by someone who understands what has played out, that has landed this young person in the emergency room. And so as that evolved, the success the goals are twofold, right? One is to assist with healing, so connect with those wraparound resources. A lot of that referral comes back into the larger GRASP program, DenverYouth program offerings, to say, here are some resources that can assist you during these times. Let's address physical healing, but let's also look at psychological healing, mental health components. Let's look at, are you in school? Let's look at your mentors. How's your family supporting you? Where are some opportunities there to expand your support? If you're not in school or not school aged, and that's not a focus for right now, is there an opportunity for trades or technical training? Is there an opportunity for employment? And so understanding what it is that would, one, help towards healing. Let's get you healed, but then also prevent re-injury, because we do know that those who are injured, suffer violent injuries, are likely to suffer a more violent or more severe level of injury the second time they're injured or in subsequent injuries. And almost 50% of individuals who are shot end up dying by a gunshot wound later. And so understanding what's at stake, but not really that immediate, like, did you show up for your follow-up appointment? But honestly, if we send you back to the circumstances that got you here to this point, severely violently injured through interpersonal violence, and we send you home to those same circumstances without assessing what got you here in the first place, then we're not actually setting you up for healing and success and to avoid re-injury. And so the success of that program then expanded to UC Health in 2020. What year is this? Who am I? 2020. And so we're 3 years into that program, or 2.5, 3 years into the 4th year now. And then just recently in this year, we expanded to Children's Hospital of Colorado. So understanding that the patient population has expanded, who's receiving services, understanding the benefit of having this community-based organization, DenverYouth program, and in particular, supporting this work, to say, this is where we're meeting you, but we're pulling you into these wraparound services as an organization. So that's kind of the structure and the model. And then to just kind of recognize that AIM is part of the national network of hospital-based violence intervention programs. And that is run through the Health Alliance for Violence Intervention, the hobby. And so seeing that this work is playing out in different cities in different ways, the point that I would raise about the AIM program in particular is that AIM is unique in this national network because AIM has one provider that services these 3 different level 1 trauma centers. So understanding that there is some flexibility for someone to respond to a different institution. There's cross badging in recent years. So the person who's on call may not be available at this point. So the other person who's on call at the other hospital can switch. Or there's a burden of need at one place and we have multiple people respond. So the team has some flexibility there and is recognized as part of the healthcare team in these circumstances. And so this regional coverage model is a little bit unique and is actually a huge benefit to the services provided overall, along with that community link to bring individuals back into the community level service. There's something else I was going to say about that, but you would probably have stuff to say about that.
Yeah, and so our credible messengers that are with the AIM program are super important because after a traumatic injury has happened to the community and someone comes in with an injury that might be life-threatening to them, their family and the community shows up at the hospital. And oftentimes there might be retaliation on the mind. There might be, finding out what the people that are involved in. Sometimes both sides are showing up at the hospital at the same time, and more violence ensues at the hospital itself. So having our credible messengers there to receive the community as the community is coming in to provide resources and counseling and some clarity around like what's really going on is super helpful, because oftentimes either they're stopped at the emergency room door and not allowed in, so they're then outside on the campus enraged and upset and confused and wanting answers and wanting action and wanting justice. And again, it opens up to more potential violence and harm. So we have to make sure that we are focusing on that piece of it. So our credible messengers are trained from the HIPAA aspect of what they are allowed to do with community, and then also from the community aspect to so the community trusts them and allows them to be able to make those moves and to navigate the situation through that traumatic injury.
And I would just say the credible messenger component of this is actually probably the most important piece. Being able to respond to the hospital bedside is very important, but who responds and how is the critical piece to making this work. And Johnnie and the team, as they've built the AIM program over the years, have been attentive to that and expanding the team, both in trauma-informed care training and healing-informed care training, but also understanding the mental health pieces and caring for the team itself, honestly, saying this is the work you do every day. This is the toll it can and does take on you and on the team individually and on the team as a whole. And how do we unpack that so that you're modeling and you're as healthy as possible for the youth and young adults that you're trying to also accompany through their healing path.
And then the last piece we want to talk about is one of the ways we've been very successful in being able to trade services and resources for guns that are in the youth possession or in the community itself is through our GRASP Enterprise program. Being able to provide them with gainful employment and opportunities to further their education is one of the ways to give them hope, because a lot of times when a young person has risen to the level of wanting to cause harm to self or others, it's because a lethal dose of hopelessness. And if we can reinstill hope in these young people, then it is more important to them of what comes tomorrow, or how they look into the community, or how they look to their families, because they have something to look forward to. With that lethal dose of hopelessness, they don't really care. And it's easier for them to grab a gun or whatever other weapon of choice to cause harm to self or harm to others or harm to community even. So that GRASP Enterprise program allows them the opportunity to maybe go back and redo school if they weren't able to do so, or maybe remove barriers to employment that they have not been able to overcome themselves, or maybe even look into entrepreneurial ideas that they didn't have the resources in which to do so. So GRASP Enterprises, we have an academy where we also, it's a junior achievement style academy where we also allow them the opportunity to practice these characteristics of being in charge of a corporation, or practice the skills that they would need to be successful in a job under our supervision, and then be mentored along the way for more job retention or school retention, as it may stand sometimes because they've gotten kicked out of school. But what character traits that they need to work on to make sure that they have the opportunity to take advantage of these resources that are provided for them. And I know, Ginny, I don't know if you want to add into GRASP Enterprises.
No, I would just say GRASP Enterprises is also part of the Homeboy Industries global Homeboy network. So this is also a national model for understanding the intersection of client need and opportunity to thrive in a sustainable fashion in the community through mentorship, but also that technical experience and then connection with long-term employment. I feel like we might be talking too long, so I want to take us to the next slide. It's just our contact information in case you might want to be in touch. And I have my 2 affiliations there. It's a lot, but the QR codes would work, or also we can send our email addresses as well.
That would be great. Thank you both so much. The work you do is valuable and sounds like you're very busy. So thank you, thank you. We do have a question in the chat, and then welcome other questions. With AIM, the hospital affiliations are connected to the University of Colorado. Are there plans to expand to other hospitals or social service partners?
Yes, absolutely. We have already received inquiries from some of the other hospitals that have maybe a higher level of youth involvement when it comes to some of the trauma that are coming to the trauma bays or the injuries that are coming to the trauma bays. So right now we're looking at creating a hub for AIM itself that would be able to respond citywide to hospitals that have violent injuries that they may want someone to come and connect with the families there to provide resources for them.
Awesome. I had an anonymous question come through around the enterprise. Are there ways that community-based organizations can support the work that you do, especially around the GRASP enterprise?
Oh, yes, that's wonderful. I'm glad you asked. So the academy itself, we try to do them at least quarterly, but we have one that's coming up. And in that academy, we reach out to the community as well as corporate community to bring partners in to not only help us train the young people, but also maybe provide resources for them as, on-the-job training sites or their expertise around some of the sustainability traits that we teach. So if someone is interested in doing that, Ginny's going to be in charge of putting that next academy together. And then after the academy itself, we allow our partners to decide how they want to continue to support the youth of each cohort or GRASP Enterprises itself. But yes, we definitely have opportunities for those that are interested to be a part of that.
The next academy begins on October 23rd or October 30th, still in flux.
Gotcha, thank you. And then another question, are the trusted messengers from differing life experiences and cultures to match those youth who are being outreached?
Absolutely. Yes, we have some that's been in the community for a long time and some that's been in the work for a long time. Since the community, we have a mobile community because of my new sexy word, involuntary displacement. You all know it as gentrification. We have some of our young people that are moving out to different places that used to be all in one community. So our case managers are programming our resources in the schools. We move around to where we know that the community has been dispersed to. And our credible messengers are coming out of the community that works with the young people. Sometimes they even, bring them out of some of the groups that they have migrated to. We have a young man that we may be bringing on who has nothing else in his resources, so he started bringing the kids together in his home, and then that moved into him being able to do it in the church. So being able to bring him and his lived experiences into our organization, because he started bringing the young people to one of our groups and they loved it, and he started volunteering, and now he may become an employee that can also start bringing those youth here. So we look for those that are organically a part of the community and a part of the work itself.
And I would say peers rise to the occasion as well. So a lot of our case management is individually based and works with the family as well. But then peer to peer, right now we're running a social media group, a pro-social positive engagement group on Monday nights, talking about gun carrying and gun violence and bullying and a whole host of sensitive topics, but primarily violence focused. And they've started to connect with each other, and they're becoming positive influences on one another. And then those are individuals who will maybe participate in our academy and then start to work through GRASP Enterprises. And so there is some fluidity between the programs, and that's intentional because we want to see what catches someone's eye, what keeps them coming back each week, and how to bolster that both with peer support as well as the broader network of case management and staff support, and then into tangible resources that can fill them with hope and keep their hopelessness at bay.
And I just have to add that Monday night group it's a group because it's called Choices. And Ginny and I, through an idea that I had found funding to actually pay these young people to be positive social media influencers around gun violence and gun carrying and gang violence. So we're paying them to actually come up with positive messaging that they put on their social media, because they have a lot of social media real estate, because that's what some of that violence is right now is starting on social media, right? So if we're changing and flipping the script and having them to be able to have the opportunity to put these positive messaging out, and then we help them to be able to follow through with that. So that was one of the ways that we're combating the idea of wanting to carry a gun, it's being cool to carry a gun and accessing guns. I mean, if you've ever taken a dive into social media, you see some young people flourishing the guns on their pictures and showing how many weapons they have access to. All that stuff is on their social media, right? So we wanted to combat that and have them to flip the script and change the messaging and code switch on what's accepted in their community as young people around the carrying, accessibility, and use of these weapons.
That's brilliant. Trusted messengers all around.
Thank you.
Yeah. Another question, are you partnering with local rec centers for referral and outreach?
Absolutely. One is right down the street from us, St. Charles, but we actually, the GOCO program is funded through Parks and Rec. So we have a direct connection with 48 organizations that we are the hub for. And each of those organizations have I would say, a pseudo subcontract with the Parks and Rec to be able to get our youth to go into any of the programs. We have a resource center at the Parks and Rec for outdoor gear. It's called the Gear Library. So we use Parks and Recs for that as well. And all of the Parks and Recs activities and camping opportunities, we provide the youth for those opportunities for them. Also, we work on their membership fee, so all of our youth get free Parks and Rec cards.
Awesome. Wonderful. Other questions, comments, reactions?
How can community-based organizations or those working in healthcare on all the different like hospitals, clinics, health departments, how can we help support all of the work that you're doing? That's for Ginny, Johnny, Matt, and Joe. We want to help lift you up and support you.
Well, I'll start and state that all of our groups we have open to the community, so that the community can come in and be a resource to our young people. With just stopping by and talking with us. So our Thursday night group, if you wanted to stop by and meet with our young people to see how you can be of a resource for them. Our Monday night group, and the curriculum that we teach, but just sending us an email saying that you're interested in being involved in what skill sets that you bring or what resources you bring to the table, that would be a good way to start. And then we can have conversation and bring you in.
I would say do what you all did, which was reach out and ask for us to get involved. I know, Johnny talked a lot about the trusted messengers and how much that matters. It was something I mentioned too. One thing I didn't say is I'm a Marine Corps combat veteran and lifelong gun owner. I've been shooting since I was a kid, right? And so those potentially difficult conversations, whether that's at gun shows or in the community or with whoever, it's a lot easier for me to have oftentimes than it is for someone who has never owned or fired a gun or doesn't know anything about them, right? I get the hesitation that a lot of people have in talking to their patients or clients about guns if they're not a gun person and they don't feel confident in their abilities to have those conversations. And so make use of us, bring us into the loop, let us help you have those conversations, let us help you or give you the tools to feel confident in having those conversations.
And I would say we're trying to build out our referral network too. So if you have organizations or services, or you are an organization that can receive youth and young adults and families for any of these different services, health related, look at any of the upstream factors, employment, access to housing, anything that can support this holistic healing process, and you want to be listed as a referral, someone who will receive referrals from us. We will also receive referrals from you, of course, but that cross referral system is something we're really trying to focus on as we build out the support network across the metro area. So anything you might share with us, name, contact info, services provided, and we could even meet to discuss further if that's helpful.
And I just have to throw out probably a very sad and pitiful plug, but we are going to be focusing on a post-discharge clinic. And we're definitely going to be looking for support around, what can we put in the resources in that clinic. That's everywhere from a building to practitioners to be available. We're definitely going to be looking for mental health services. We have contracts now with a couple of mental health organizations to provide that services for our young people. But if we have others that are interested in doing that, we're bringing together those that we can have at that table for our initial pilot program of our post-discharge clinic.
We're happy to connect folks to this webinar is recorded, as you can see. So we will be sending that out. So really helping spread the word about the work you do and connections to be made. So thank you very much.
Thank you.
Any other questions, comments, feedback? If not, we'll say a huge thank you to Joe, Matt, Johnnie, and Ginny. Thank you all so much for the information and for the work you do. We will send out this recording, the slides, resources to folks, and please feel free to send us any questions if you want them filtered through any of the speakers. Thank you very much.
Thank you.
Thanks, everyone.